Greetings to the New York State International Training and Research Program alumni and faculty, NYISTRP. It's been a while since we last communicated, and I wanted to bring you up to date on a number of events that have impacted our program. First, of course, each and every one of us has been severely impacted by COVID-19. The emergence of a novel coronavirus has always been one of my great fears, and we've now seen the impact. In spring 2020, we were hit very hard in central Brooklyn. The governor designated SUNY Downstate as a COVID hospital, and for 2 months we focused only on that. Medical students were graduated early to help on the wards. We created 2 specialized infectious diseases teams, and almost all of our clinical visits rapidly became telehealth. I was quite impressed by the resilience of the faculty and staff, and so pleased that even given the 2 subsequent peaks after that, our census remained manageable and our quality of care remained superb. Obviously, this has also had an impact on our own training program. Fortunately, through a quirk in our schedule, we only had 2 students studying at the University at Albany School of Public Health. Obviously, all the courses immediately went virtual. One of our trainees, Aizan Kiyaseva from Kazakhstan, spent most of this last academic year working on her thesis, addressing the relationship between antiretroviral therapy and COVID-19. She successfully defended in July 2021 and is now returning home. The other student, Maria Schwab, was a Ukrainian candidate for the certificate program. She arrived in August 2020 and completed her training in May. She has now returned to Kiev, where she is a training developer at the International Training and Education Center for Health, ITEC. Obviously, she didn't have much contact with her fellow students or faculty, yet we were all so impressed by how well she did both socially and academically. You all have also done a great job in your own countries. I've been so impressed by the stories I hear regarding leadership in the setting of the COVID epidemic. I know it's been a difficult time, but I'm pleased so many of our alumni were able to contribute to their respective national response. The NYISTRP continues to expand. In 2020, we were awarded a 5-year HIV research training grant with Georgia. This was the first instance where an in-country leadership took major responsibility for writing and submitting the proposal. This was led by Mamuka Djibouti, who directs the NGO Partnership for Research and Action for Health, PRA. This NGO is working closely with Tbilisi State University, or TSU, to develop a doctoral program in public health. 10 trainees will be taking joint training at TSU and the University at Albany. In addition, they will each have a programmatic rotation through the New York State Department of Health AIDS Institute. There's more good news. In 2021, we were awarded a 5-year renewal of the HIV research training program with Kazakhstan. This effort, co-led by myself and Dr. Jamilia Nugmanova, links an NGO, the Global Health Research Center for Central Asia, with the Kazakh National Medical University School of Public Health. The major effort of this renewal will be to enhance the curriculum in epidemiology, biostatistics, and substance use. A key element will be a distance course from the University at Albany called Public Health and Addiction. We're currently working on our renewal grant for Ukraine. I've been so impressed by the tremendous publication productivity of our Ukrainian alumni, and I'm hoping for good news for this application also. It's been an eventful 2 years, and I look forward to communicating with you and hearing about your careers. Our faculty and I look forward to resuming travel when we can to see you all in person. Let me also take a moment to remind you that we have a weekly HIV infectious disease research conference at noon Eastern Time, of course, on Thursdays. We will continue to send the links and hope that some of you can join us. In the meantime, best wishes for the upcoming academic year and stay safe. Thanks so much for all you do.